COVID-19. Have you ever known anything that has completely turned the world upside down? Take away the health issues, we have governments globally reacting differently and with different results. Incompetent governments, such as the Victorian government in Australia and various states in the US, such as California and New York, have created a creeping Armageddon of economic destruction and simply the way we live. Today we explore Pakistan and its successful war with COVID-19. Hello, I'm Mike Ryan and welcome to BNAP Today, September 14, 2020. First it was China's Belt and Road Initiative, and now the West is looking at China's 1,000 Talents program. Is China stealing research? More on that later, but first, the headlines. COVID-19 is affecting 213 countries and territories around the world, sending billions of people into lockdown as health services struggle to cope. More than 29 million have or have had the virus, and close to 1 million people have died. However, Pakistan have had a steep drop in infections. Dr. Faisal Sultan is Prime Minister Imran Khan's Special Assistant on National Health Services, Regulations and Coordination. Faisal, thank you very much for joining us. Pakistan has recorded a steep drop in infections since its peak, surprising many commentators. Could you bring us up to date on the change in Pakistan's infection rates and deaths in recent months?
Yes, I think we've had a steady decline since the middle of June. There were a number of different projections, both within the country as well as outside, and all the projected numbers from either data science calculations or epidemiologic calculations seem to suggest that the epidemic, the numbers were going to be much worse than they actually turned out to be. So the what's there, meaning we do know that death numbers, the new cases per day, the percentage positivity, the occupancy of the health system, all of these parameters have actually come down steadily and consistent with each other. All the numbers have been have had internal consonance with each other. Now, the question of why is a much harder one because we do have countries with similar socio-economic situations, and yet they are different. We have India at the present time, the numbers are still high, and many cities are struggling with the virus. So, what is it that made a difference? To be perfectly honest, there are two parts to this. We can divide this into our programmatic interventions, and of course, the second part would be the biology of the disease, which really encompasses the host, the pathogen, which is the virus, the environment, and of course, the social structure of the society. But let's talk about the first part, which is the interventions. I think one of the most important interventions that we were able to do in Pakistan was to sit under one roof in one room and coordinate and collate all the data coming through from every single lab, from every major hospital, then to evaluate, analyze, critically look at this data, and to devise strategies for intervention. And then to reach out to all the provincial decision makers, with their health ministers, with their senior bureaucracy, as well as the chief ministers. And so this coherence, coordination, and a unified response is, I think, the single most factor that helped us in synthesizing, putting together this response. This included a lot of different inputs, and one can barely go into details on any one of those. But the fundamental issue has been ensuring that the data that is coming in is right, is accurate, is timely. The analysis of it is done in a nuanced way and with full critique and dissection from all sides. And then once the actions are decided, they are communicated to those that are going to implement them, down to the smallest administrative units, as well as hearing back from them as to what was feasible, what was difficult, where the issues were, and then to go back and try to fix those as well. So I think, if I were to narrow this down, our actions were data driven, and I think they had consequences. Every action in an epidemic may not be perfect. You may say, well, wear masks, and only a certain percentage of people are wearing masks. You may lock down a certain area, but the restrictions may not be perfect and may not be perfectly enforceable. Yet, because an epidemic depends on the number of interactions between infected and uninfected individuals, each time you reduce the statistical odds of the interaction, the epidemic slows down by that very much, and then it all.
What's the situation in terms of testing? Has testing increased or stayed the same?
So when we started out, well, the testing story, we should, I think, begin right at the outset. So we started out with 1 or 4 labs in the country, and then we gradually built up our capacity. So that was the first challenge, was to be able to have labs that were able to do the PCR for coronavirus across many different domains and areas across the entire geography of Pakistan. And that was built up gradually and organically, but in a pretty fast pace, I would say. So we were able to reach full capacity of testing between 50 and 70,000 tests every day. At no point did we utilize all of this capacity. At the peak, we were doing about 30,000 tests, and as the disease abated, the number of daily tests have come down to about between 20 and 25,000. I would say the average on a given day in the last few weeks has been about 22,000 tests a day. So while they are not a huge number of tests, but they are enough that provide us with some semblance of what's going on. And we've not just looked at the absolute positives out of the test, but trends, and what were the statistical likelihood of a test being positive on a given day. And so as time has gone on, we have come down from, so 20s, so 22, 23% positivity in June down to below 2% for the last week or two. So that's been a very important parameter to look at, especially when you are not doing tests that are, that cover the entire population or anywhere near that. So I think we've utilized and deployed our tests, very strategically, and to make sure that the resource that we have brings us the most information, both for clinical care as well as for strategic decision.
I see that the military have also been used to help support the effort.
Right. So they were very important partners in this whole effort. So the National Coronavirus Operations Command Center was chaired by our Minister for Planning, Mr. Asad Umar. And so on one side, we had the professional inputs, the Ministry of Health, data scientists, people like myself, who at that point were in their role as infectious diseases physician, other people who were related to the response and decision-making ministers from a wide range of ministries, from food to interior and so on. So there was this professional and administrative group on one side. Our military component was made up of people who helped us with the logistics, with coordination, and a lot of follow-up, and a lot of back-end support. So, for example, once we put together our contact tracing, for example, or the lab testing facility, or the lab testing connectivity. So a lot of follow-up and ensuring that any loose ends were tied up, that we were able to resolve difficulties out in the field. That was really very nicely done and in a very synchronized and harmonized fashion by the military. So I think everybody played to their strengths. The leadership on one hand, starting with the Prime Minister, the professional side on their end, and of course the administrative and logistic and coordination side, primarily by the military.
Does Pakistan have a large contact tracing system compared to other countries?
So countries that have had stable and well-developed public health systems obviously had, contact tracing systems in place. Compared to them, I would say that our contact tracing system probably bore a ratio of anywhere from 1 to 8, 1 to 10 of the number of people that many of these countries had available, trained, and deployed. We had to really ramp up this capacity and learn this and teach this and train this as we went along. But I think very interestingly, and because of all the help from all quarters, this contact tracing capability within the provinces down to the districts and towns really improved tremendously. So at the present time, for example, we are contact tracing about 15 people for every index patient that are positive. So it's not a bad number to be in at this time. And it really has helped in a number of different ways. First of all, the obvious effect in contact base, you educate, you train, you restrict their movement, you talk to them, and obviously you can't, post a policeman outside every house. So much of it is about education, about reinforcement, and I think the ripple effect from that also goes out. The neighborhood realizes what's going on, and so people cooperate and come together as a community. I think it has the educational and communication value of contact tracing is sometimes underestimated. So I think that's also been leveraged in our case. So I think we started out in a somewhat weaker position, but we're much stronger, much better, and we hope to be able to sustain and build this further. One other thing I'd like to point out is that the strengthening of a contact tracing and public health response capability really helps in a number of other diseases. Tuberculosis, we are one of the countries that has high incidence of tuberculosis, and we lose people to TB every year. So I think improved contact tracing will help tremendously for other diseases as well. So this has been a success. Actually, we started out on a weaker wicket.
Many countries have imposed lockdowns on business, and in Australia, for example, closing internal borders. Now, this causes serious economic hardship. One of our states, Victoria, has even imposed a night curfew. Now, apparently there exist no medical reasons for such harsh measures. Can you make a comment on these measures imposed across the board?
So lockdowns also generated a fair bit of anxiety, controversy, debate, and a fair bit of polarized debate, I would say. So when we started out back in March, the first restrictions that were put in were mid-March for education institutions. I think strategically, scientifically, that was probably the most important step. Somewhere around the 23rd, 24th of March, what ended up happening is that a number of provinces and provincial leadership looked at the data coming in from, at that point, Iran and Europe, and of course, initially from China, and the almost extrapolated idea of broad lockdown gained a lot of traction. Now, the problem with, of course, a broad lockdown is that while if you could do it perfectly or near perfectly and for a sustained period and everybody did it all at once, it has the chance of slowing or stopping the epidemic. But in the connected world we live in, it became fairly clear that a sustained, general, broad lockdown was just not possible. So after the initial period of restrictions or lockdown, what we started to do was to evaluate how to come out of this whole process. Locking it down in many ways is probably easier, but to unlock and to gradually descend down from that position is a much harder thing. So in that situation, we looked at what the risks were. We tried to evaluate the risks of opening each industrial sector, each business sector, each work activity. And so very slowly and gradually over a period of many months, we are at the present situation where we are about to open up the most significant part sectors, which is education. So starting 15th September, we are opening education institutions in a graduated way. So this whole business of lockdowns and restrictions was tough. There was great political divide as well, because a lot of people, the more urban, educated people connected well to the rest of the world, saw the really terrible numbers coming out from other countries and felt that the only way around was the lockdown. On the other hand, the larger rural, semi-urban populations did not have any experiential, any experience of the virus themselves, and were perhaps less aware of the rest of the world, were more focused on the fact that they had not seen anything, and that many people felt that this was just all overblown. So to keep balance between these two almost opposing narratives was tough. And so therefore, at each time, the political leadership, the governments of the provinces had to constantly talk, reach out, explain, and bring, as I said, a coherent, more unified response and point of view of what this was all about. At the present time, we have evolved into the smarter, more targeted, smaller lockdowns. So as the numbers have come down and as we have better understanding of the data, we are able to restrict our lockdowns to very small units to allow businesses and work to continue, and yet to try to ring-fence the disease where it was well in the region.
How do you see the virus changing Pakistan in the long term?
It's changed us already, I think. How much of these changes, how many of these changes sustain over time obviously depends on how quickly the virus fades away. But it has changes. I think some changes have been for the good, in the sense that we've tried to strengthen our healthcare system, and there is a much greater focus and understanding of the importance of investing in healthcare, particularly the public health system. The society at large, I think, also has changed, like the rest of the world. What used to be a fairly common and routine occurrence that you never thought about it, walking into a restaurant, getting seated at a table and eating, is something that a lot of us just haven't done in months and months. Travel, then how we conduct, of course, our routine businesses, like, as I said, schooling, education, and how we adjust and modify ourselves around it. So I think that, I'm sure it has created anxieties and pressures and issues relating to stress as well. But I think generally the world scope well with it, but it depends a lot on how this epidemic slows down and phase out of the system, and if ever there are any resurgences, etc., that will also determine how it affects our future behavior and for how long do these changed behaviors remain in the system.
Dr. Faisal Sultan, thank you very much.
Thank you.
After this break, we find out more about China's 1,000 Talents program, subtitled, "Is China Stealing Research?"
As the world faces the challenges of the ongoing COVID-19 pandemic, Lions recognize that kindness matters now more than ever. And Lions and Leos are finding ways to continue to serve our communities, including ordering food delivery for healthcare workers, holding story time for children online, and providing surgical masks to medical professionals and first responders. Empowering us to do more, Lions Clubs International Foundation has provided nearly $2.5 million in grant funding for COVID-19 relief. And that support continues to grow. For more than 100 years, in times of need, Lions always find a way to help those around them. And after we emerge from this, we will be stronger than ever. Visit lionsclubs.org to learn more.
So is China stealing research? Universities globally, including Australian universities and China's Thousand Talents program, have been in the news lately. China's Thousand Talents program have been described as an initiative which seeks to recruit leading scientists for a secretive research program that offers lucrative salaries and perks but requires them to work for Chinese government purposes. Professor Lawrenson is an expert on contemporary developments in China's economy and the Australia-China relationship. James, thanks for joining us.
Good to be with you.
Tell us more about Australia's collaboration with its top research partners such as the UK, US and China.
You mentioned a number of countries, and that's for good reason. Australia obviously has pretty limited domestic resources. We only account for actually less than 1.5% of global R&D spending. So we've always relied actually on international collaboration to stay at the knowledge frontier. A big three, China's now our number one partner. What I mean by that is more Australian scientific and research publications have a co-author affiliated with a Chinese institution than any other country, about 16.2% of the total. America's number two with 15.5%, and then the UK is in third place with 11.7%. So you can see the diverse range of partners that we have. That's long been the case. What has changed over time is the weight given to each partner. China has certainly been rising in prominence.
Is all this research conducted in universities, or does it include private institutions?
Yeah, that's an important point. In Australia's case, it overwhelmingly is in universities, unlike, say, America or China for that matter, which have giant technology companies. Australia doesn't. So what that means is most of our scientific research is conducted in universities, and it also means that it's basic foundational research, as opposed to research that's right on the cusp of being commercialized, like you would expect a private firm to be most interested in. So that's another reason why we have to be a bit careful that we don't just automatically transplant debates around research collaboration from America to Australia, because the nature of the research is quite different.
Where is Australia's research collaboration with China mainly concentrated?
Mostly in the hard sciences and engineering. So, for example, there's three areas, in particular, material science, chemical engineering and energy, where more than 30% of Australia's total scientific publications in those subject fields involves a Chinese collaborator. So they're the big three. And it's interesting because when you look at where we work with America, it's actually a different area. It's more in life sciences, medicine, those sorts of spaces. So when we work with China and when we work with America, they're actually not competitive. They're actually quite complementary.
China's Thousand Talents program has had some publicity of late in Australia and the US. Would you describe it as a Chinese recruitment program for scientists?
I think that's largely fair. It certainly is an attempt to attract talent, whether you want to call it a recruitment program or not, but an attempt to attract talent. And I've got to say, Mike, that is entirely unremarkable. Many countries have scientific talent recruitment programs, including Australia. And actually, this is where context matters. So I see a lot of the headlines recently presenting the Thousand Talents program in some nefarious way, but China's got a real problem. Let me explain it to you just with a quick example. There was a study done last year that found 85% of China's best researchers in artificial intelligence weren't actually in China. Most of them were overseas. So there's a strong incentive for China to try to bring some of those people back home.
Are there likely to be many researchers in Australian universities involved?
Well, we know there are some because they've told their universities that they are involved. So this is another thing we need to be careful of. The fact that a scholar is involved in the Thousand Talents program is not a sign that they're disloyal to Australia. Sure, if they're hiding that affiliation, that would be a problem, but that's a separate question.
It'd be pretty hard to hide it though, wouldn't it, if you think about it? I mean, it's not something you can keep a secret for a long time.
Right. There's plenty of open source information that, for example, if our security agencies had a particular interest in a given academic, I don't imagine it would be too hard to track down. But and by the way, universities are very clear in what they expect of their academics. I can assure you, where I work at, we have an outside work policy that's very, very clear. So all academics know what they're meant to do.
So then, what are the most contentious aspects of the program?
So we're dealing in allegations mostly. So, for example, some of the allegations have been that the Chinese side is instructing participants in the Thousand Talents program to keep it a secret from their Australian institutions. There's also allegations that Chinese Australian scientists, or actually not just of Chinese ethnicity, but Australian scientists are signing up to this program and then registering IP in China. Well, that's an issue, but it's not. Again, I think you've got to separate them. So if that's the concern, then you want to make sure that universities have in place the policies to protect IP. And I can assure you, Mike, Australian universities are very keenly watching the dollars. So if they see one of their academics who is involved in research that could have a commercial application, they'll be very keen to sign that academic up.
What do you think will result from this? Will Australia's research relationship or trade relationship with China then be affected?
I remain optimistic, and I think a lot of this, what will happen, will be dependent upon how the government implements this new legislation that they're talking about. For example, if it's simply about having transparency around the research collaborations universities have in place, well, that's fine. That's not going to stop collaboration. But if what it does, or indeed if the government starts doing it themselves, starts citing those research collaborations and somehow using it as material for some McCarthyist witch hunt, as we've already seen some media agencies willing to do, that could well be quite disastrous. I mean, why would you? Say you're a top Chinese Australian scientist at a leading Australian university, why would you cop that sort of vilification? You're going to go elsewhere. And you know what? You may not go to China. You may go to Canada, the UK, America, or somewhere else.
Interesting days ahead. Professor James Lawrenson, thank you very much.
My pleasure.
Well, that's it for BNAP today, September 14, 2020. And don't forget to subscribe to our YouTube channel, Business Now Asia Pacific. Thanks for joining us. I'm Mike Ryan.